All right, welcome back to ABA exam review and the continuation of our BCBA practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Your wife tells you that if you do all the yard work and the laundry today, then she will take you to your favorite restaurant for sushi. That same day, you end up having sushi for lunch before you take care of the chores. Sushi for lunch would be considered what? So let's think about what the sushi is acting as in this situation. Your wife sets up a contingency, right? Because your wife says if you do the yard work and the laundry, you get to go to your favorite restaurant for sushi. So if you do chores, then you get sushi. Your wife is setting up the sushi as reinforcement. But you end up having sushi for lunch even before you take care of the chores. What do we call it when you get access or somebody gets access to reinforcement they didn't earn? A, non-contingent reinforcement. Now be careful. Non-contingent reinforcement is reinforcement that does not depend on anything, on any one behavior, I should say. But it is systematic and it's planned. So it is not the same thing as B, bootleg reinforcement. Bootleg reinforcement occurs when the reinforcement is obtained and it shouldn't have been obtained. This is not negative reinforcement, right? You're eating the sushi, and it isn't unconditional because we would not describe something as unconditional. The problem here is you received reinforcement when you shouldn't have, and you didn't engage in the correct response, so you received bootleg reinforcement. Elijah will typically run into the laundry room and shut the door in times of frustration. This typically is followed by a 10-minute break from work. Now, Elijah is no longer receiving a break if he goes into the laundry room, but he will get a break if he stays at the table and completes at least 5 minutes of work. Elijah stopped going into the laundry room, but after a while, he stopped receiving a break for working, so he went back to the laundry room. How would we describe going back to the laundry room? Long question with some different things going on, right? So we always want to attack the question and make sure we understand what information we're given. First, the question wants to know, how do we describe going back to the laundry room? Because we know he stopped doing it for a while, and then all of a sudden he's back in the laundry room. So originally he would go there for frustration and he'd get a break. So it appears was happening for escape. Instead, the behavior was put on extinction because he would not get a break for the laundry room, but he was reinforced for completing 5 minutes of work. So clearly a differential reinforcement approach. Laundry room was on extinction, work was reinforced. Now, once he stopped going to the laundry room, he also stopped receiving reinforcement for working. So the replacement behavior was no longer reinforced. The old behavior came back. How do we describe that? A, extinction. The original strategy was extinction, but we're talking about going back to the laundry room. B, extinction burst. An extinction burst would have been a temporary increase after extinction started. We're talking after extinction is done. What is the difference between spontaneous recovery and resurgence? When we are talking about replacement behaviors and replacement behaviors no longer be receiving reinforcement, which cause old behaviors to come back, we are talking about resurgence. Spontaneous recovery is just simply the reemergence of the old behavior. Resurgence is tied to that replacement behavior no longer receiving reinforcement. Tommy is working with the client to decrease their alcohol intake during the week. After a few weeks of intervention, the client is only drinking 2 days a week instead of 5 days a week, but the client has started to drink significantly more on those days that he does drink. What has changed in this scenario? Question wants to know what changed. Well, what do we know so far? We're always asking ourselves, what do we know? What is the question telling us? Tommy has a client, they want to decrease their alcohol intake. The client has gone from 5 days a week to 2 days a week. So right there, something's changed. What has changed here? If we go from 5 days to 2 days a week, our frequency of drinking has changed. But the client also started to drink more on those days. So when we talk about things like more or less, big or small, loud or soft, we're talking about magnitude, right? The intensity. So what changed in the scenario? A, frequency. Yes, the frequency of drinking has decreased. B, magnitude. Magnitude has also changed, but this one has increased. Now the magnitude of what he drinks has gone up. And then topography. Well, we don't talk about how it looks or the change in how it looks. So topography does not appear to have changed or it's not discussed. What we do know changed was the frequency of drinking and the magnitude of drinking. So our answer here is both A and B. You're working as a behavior analyst in a large practice in a big city. You currently work with 10 different clients and put in about 35 hours per week. Based on past results, you barely have enough time to supervise each client once per month. Now, your boss is requesting that you take a high priority client and add it to your current caseload. What should you do? As analysts, we want to be able to serve as many clients as possible, but we also want to provide good service, ethical service, service that our clients deserve. And if we are serving 20, 30 clients, it's almost impossible to provide great service. In this case, what are we going to do? Because you work with 10 clients at about 35 hours a week. You already barely have time to supervise each client once per month, which barely is enough as is. Now you're supposed to take on a high priority client and add it to your current caseload. Is that even possible? What are you going to do? A, determine which current client least needs services and begin the exiting process with them. Exiting a client to take on a new one because they're quote unquote priority is not ethical or a good way of going about terminating services. A is not a good choice. B, take on the client even if it means your easier cases may get less attention. This is a common problem where we think quote unquote easy cases need less of our attention. Don't become that BCBA. Let's treat all cases and all of our clients with the respect they deserve. We're not neglecting somebody because we think they're quote unquote easier. C, only take on the client if you can reasonably manage your time across your cases. Yeah, if you can reasonably manage your time, take on the client. Based on this information, you probably can't. But again, we need to conduct things like a cost-benefit analysis to figure that out. D, take on the client, but only on a 2-week trial basis. Do not do this, right? You're setting up false hope and false expectations for your services. If you're just, after 2 weeks, going to quit on that client, you should have never taken them in the first place. That's not ethical. You're giving the wrong impression about what you're going to provide. Correct answer here is only take on the client if you can reasonably manage your time across all your cases. Empirical research recommends IOA be collected how often? All right, kind of a different sort of question, kind of a teaching question. I only throw it in here because it's good to know. And this is straight from the 3rd edition Cooper. And in the 3rd edition Cooper, they recommend IOA be collected at minimum 20% of sessions, but ideally between 25 and 33% of sessions. Is this going to come up? Maybe, maybe not, but it's a good teaching question, and we're just raising our awareness and raising our knowledge base. You have used an intervention to teach communication to your clients for a year now. The intervention is typically successful and easy to implement. Now, there are new studies showing that the intervention you are using may not be the best possible intervention and that a new method should be tried instead. You refuse to believe that your intervention can be surpassed since you've had so much success. You are failing at what assumption? So let's be careful here, right? Because as scientists and behavior analysts are scientists because we're practicing science and we are looking at human behavior, we want to engage in what we call philosophical doubt, where we are always questioning our held beliefs. In this case, you have an intervention that's been successful and you believe it's the best way. A new study comes along that is telling you maybe you don't have the best way of doing things. But instead of questioning your own beliefs and your own results, you're just flat out refusing to believe your intervention can be surpassed. What have you failed? A, parsimony. This is not really a parsimony question because we're not trying to figure out the simplest explanation. It's not a pragmatism question because we're not deciding between two choices and being practical about that. What you're not doing is engaging in philosophical doubt relative to your beliefs about your intervention. Everything we do, we need to constantly be questioning and thinking, is this the best way? Is this true? By you saying, well, no way anything can ever get better, you're not engaging in the idea of philosophical doubt. Now, you can say you're not being empirical, but there's really nothing to be empirical about. If anything, you're saying, well, I have empirical data backing up my intervention. That means it's right. You're failing to engage in philosophical doubt by not questioning maybe you don't have the best way of doing things. If you wanted to develop a task chain to teach someone how to bake a cake, which of the following approaches would be least appropriate? When we are developing a task chain, we're going to use a task analysis. And what should we analyze? Well, we want to analyze, obviously, the behavior we want to break down. In this case, baking a cake. Now, if we want to create that task chain, what is going to be least appropriate? A, observe world-famous pastry chef Christina Tosi making a cake. Well, if you observe a world-famous pastry chef making a cake, they're probably going to be pretty good at it. So you can probably get a good idea of the steps that you need to take. B, record yourself making the cake and adjust your chain accordingly afterwards. Assuming you can make a cake, this would be a fine strategy, right? Because typically, especially if you're working with younger children, we are working on behaviors we know how to do already. So if you can make a cake, B is fine. C, consult a baking instructor at a culinary academy. Sure, these are also experts, and you're consulting experts on how to make a cake. D, observe someone of the same age as your learner baking a cake. We want to typically avoid the fallacy that we need to just find someone of the same age as our learner and copy them, because we don't know their skill level. We have no idea what they know, what they don't know, if it's right, if it's wrong. Now, does that mean it's always going to be a bad strategy? No, but out of these four, it should be your last resort. You should try to find an expert. You should try to observe an expert. You should try to observe yourself before we just go looking for someone of the same age and blindly observe them. A basketball player often struggles with focus during free throw attempts. To improve performance, the player begins telling himself, stay calm, focus on the hoop before each shot. Over time, the free throw accuracy improves. What behavior is the player engaging in to influence their performance? Pretty straightforward self-management question, right? Because we have a basketball player and they are trying to influence their performance by doing what? By talking to themselves. They're saying, stay calm, focus on the hoop. What do we call it when we talk to ourselves? Well, we call it self-talk, or A, self-instruction. We are instructing ourselves, we're walking ourselves through this behavior. It's essentially self-prompts. It isn't self-monitoring. We're not monitoring ourselves by taking data on our behavior. It isn't self-evaluation. The basketball player is not comparing themselves to anything. And graduated guidance is a physical prompting strategy. It's obviously not graduated guidance. The player is engaging in self-instruction. A team of doctoral students want to use changing criteria and designs for their next research paper. In order to do this effectively, what should they avoid using as their dependent variable? So what is a dependent variable? The dependent variable is going to be our target behavior for change. What are we trying to affect? And we know the team of doctoral students want to use a changing criterion design. Now, in the changing criterion design, what are we targeting? Well, we're targeting behaviors for increase or decrease. Those behaviors need to be known already. We're not teaching anything with a changing criterion design other than increasing or decreasing. So if you look at A, hours slept during the night, that's a behavior already in the person's repertoire. We could target that. B, learning unknown letters. We don't want to use changing criterion to teach unknowns. That is not the purpose of the design. C, words read per minute, increasing or decreasing. I don't know why you would want to decrease it, but increasing words read per minute would be fine. And miles jogged, sure. Increasing or decreasing miles jogged will be fine as well. These are behaviors in the repertoires, no big deal. Teaching unknowns is not appropriate for a changing criterion design. The janitor wants to learn how often JD steals pudding from the work cafeteria, so he sets up cameras in the storage closet where the pudding is kept. Out of the 15 times JD walked into the closet, he took pudding 5 times, took toilet paper 4 times, and took nothing the remainder of the time. What percent of occurrences did JD not take the pudding? So a measurement question with a twist. We're looking at percent of occurrences. And what does percent of occurrences measure? It measures how often or how something happens or doesn't happen given opportunities, right? This is all also called percentage of opportunities. In this case, we have 15 opportunities for JD to take the pudding. He took pudding 5 times, toilet paper 4, and nothing the rest. So what percent of occurrences did JD not take pudding? Well, 4. And then if we think about the remainder, which is going to be 6, then we had a total of 10 times he didn't take pudding out of 15 possible. So what percentage are we going to get? We are going to divide 10 by 15, and we're going to get 67%. JD did not take the pudding 67% of the time. Thanks for watching. Please like, subscribe, and share. Check out behavioranalyststudy.com. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.